Doctors say more patients are asking them about unproven coronavirus treatments, including hydroxychloroquine and drinking bleach. As Dr. Maria Simbra explains, health experts say they're now caught in the middle of the spread of COVID misinformation.
Misinformation about coronavirus is an issue when patients bring it to the doctor's office. The motive is not to disagree, but to find comfort.
And one of the things that they do when they're hoping for the best is they're looking for news articles and they're looking for information that defends their position or justifies what they're thinking.
But it can cause friction. For instance, some patients demand certain medications, such as hydroxychloroquine, even though the numbers don't support its use. Or they want a doctor's excuse to not wear a mask.
We actually do have people that come in that one excuse is we have people who come in who actually say that they have a doctor's excuse not to wear their mask. And I have to remind them that I am their doctor and that I'm requiring them to wear their mask in the office.
In Connecticut, a doctor's note is now required to go without a mask in public.
Laws like that are really setting doctors up to either give in to what a patient wants, knowing that it's not medically the correct thing to do, or you have to take a stand, and unfortunately then it can ruin the relationship between a doctor and the patient.
Some people wait too long to seek medical care because they believe COVID-19 is not a big deal, or that the hospital is a dangerous place.
People are very afraid to go to the hospital. They are very afraid to see their doctor. And unfortunately, we are seeing some bad outcomes from it.
And in some cases, surviving family members have argued with doctors for writing COVID-19 on the death certificate because they believe some sort of kickback is involved.
People say that doctors are inflating the number of deaths. They're inflating the number of illnesses because they think that there is some sort of conspiracy.
Researchers in the UK looked at these issues with surveys of almost 2,500 people. They found the more people got their information from social media, the less likely they were to have health protective behaviors, such as social distancing and hand washing. But they were more likely to if they got their information from broadcast media.
When you're dealing with broadcast media, there are standards. When all of your information comes from an internet source, so much of that isn't verified.
Dr. Lamb points out fear and caution can be healthy, but you can overdo it. He's actually had to recommend to some of his patients to decrease the amount they view social media and the internet, something he calls doom scrolling, where everything they see is scary and paralyzing. I'm Dr. Maria Simbra, KDKA News.